Hello. Why am I always so excited to use Hydrofera Blue? This is Hydrofera Blue. Now, I know it does not look truly blue. It's kind of more purplish in color. But the reason why that is it's made of a foam called polyvinyl foam with methylene blue and gentian violet. The reason why I like this dressing is it's very absorptive, which I'm going to show you in a second. And it has antimicrobial properties, meaning there's certain elements in this foam which has methylene blue and gentian violet. These have been around for decades. They're known to minimize what we call biofilm, decreasing the bacterial load. When you have bacteria in a wound, where there's colonization, you have drainage, and this can hinder wound healing. So these two agents, both methylene blue and gentian violet, can minimize the bacterial load, or what we call the biofilm. Because it's very absorptive, it can dry the wounds out. As we've talked about in other episodes, the most important thing is when you have a draining wound is to dry it out. If there's too much drainage, that means there's too much bacteria in terms of colonization or potentially infection, and that can hinder wound healing. So you really want to dry wounds out. Once we can dry a wound out, then we can start exploring other more advanced techniques to heal the wound. Hydrofera Blue can be used for many different things. The one thing you have to do is this one is kind of the hard version, meaning it comes like a cardboard. When I open up, I'm going to show you. I'll cut it open here. You can see it's really hard. It's hard. It's kind of like a cardboard piece. You can't apply this directly to the wound. It needs to be activated with saline, which I'm going to show you. What's nice about this is you can put this on flat wounds on the lower extremity of your legs. You can pack it. You can kind of fold it. I'm going to show you. So like on a small wound of the leg, you can use a small piece like this. Now I fit it to size because it absorbs. I'm going to show you. So right now, here's the flat version. I'm going to put a little saline. This is just normal saline in a bottle. I'll show you, nothing fancy. Opened it up. You have to moisten it. Now what I do is, after I moisten it, normally I do gloves with this, but since we're not putting this on a patient, I have to show you. You squeeze out the extra saline, and it becomes like see it now, it's nice and soft. So this can go right to the wound. This is great for lower extremities when there's kind of what we call slough. Remember in the Santal video, we talked about slough. This is kind of necrotic or dead tissue. This helps pull that off. This works great with Santal, which was that one we talked about. That is an enzyme called collagenase that helps remove the slough. This works really good on lower extremity wounds, venous stasis ulcers, as well as vascular ulcers. I like it a little better for draining wounds than alginate dressings or Aquacel, which we'll talk about. Now, you see right now, you get to do kind of arts and crafts with this. Let's say we have a large, deep cavity, which we've gone over in other videos. Is you see this? This is kind of hard. I have to wet it. I squeeze out the saline as I talked about. I normally do this with gloves, but since we're not seeing a patient now, it's soft. I can kind of fold this up and pack this into a nice cavity. It works great. Now the one thing is when you pack this is you don't want to make it too big. Meaning you actually want to make it the size of one a little bit smaller because this absorbs. As you can see, this absorbs a lot of water, a lot of saline. So if you're putting this in a wound, it's going to absorb a lot of drainage. What that means is if you make it bigger than the wound, you kind of just stuff it in there, you kind of slam it in there. It's going to absorb that fluid and actually can expand the wound. So I've seen mistakes made by both physicians, even myself, nurses, caregivers, where they just want to like heave a big piece in like this into a small cavity, kind of mushroom it in. You put it in like this, and as it absorbs over the 24 hours, it can kind of expand. Normally, I recommend using this for daily wound care, but this can be used actually every other day, and sometimes you can actually leave it on for a week. I don't usually leave dressings on for a week because just they get contaminated or dirty. There's really no contraindication to using this other than a severely dry wound. Because this is moist, if it's a really dry wound and it absorbs all the fluid, what happens is it gets dried out. So the only time I would not use this is if you don't have a moderately draining wound or moderate fluid coming out of the wound. If it's mild to almost none, I wouldn't use this just because it'll dry out and it'll stick. When you pull it off, it becomes very difficult and can be traumatic and can hurt the patient. But for the beginning wounds, even infected wounds after cleaning it, it works great, it absorbs it. Now, one thing I do use this very routinely with is negative pressure wound therapy or VAC therapy. I don't like to use the black foam. And if you've seen videos when I've done VAC therapy, I use this because one, it has antimicrobial properties that we discussed. Two, if there's a leak and it's not changed immediately, this is a normal dressing. So you don't have to worry about that black foam touching the wound and having to be changed within 1 to 2 hours. I think it actually works better than the black foam because one, it helps dry out the wound and you get the antimicrobial properties of both the methylene blue and gentian violet. So overall, it's a really great dressing. The nurses, caregivers are always like, why it's your favorite? The reason why it's my favorite is because it can be used for almost anything. It really cleans up wounds nicely. I saw a patient yesterday who had lower extremity wounds from both pressure as well as from that were post-surgical. He had kind of the yellow grime or slough. Everyone thought it was slough. It really wasn't slough. It was just drainage that was stuck to the wound. So you have to aggressively clean those. And I recommend using Hydrofera Blue. It was a flat surface. And you can imagine, you can cut this up. My scissors need a little sharpening. Not good for a surgeon to have blunt scissors, right? I put this right on the wound. You change it every day or every other day. It will pull all that residual schmutz or slough off the wound, as opposed to putting ointments or moisture, which will not take that drainage or slough off the wound. So in summary, Hydrofera Blue, it's a great dressing. It's in the foam family of dressings. Even though this looks like cardboard, it really isn't. You just have to be active by saline. There's a different version where it's already pre-wet. It comes in a foam version. I like those, don't get me wrong. Just I have a lot of this, and I prefer to use this because you get to really tailor it. And it comes in a really good size. It's generally 6 inches by 6 inches. They have other smaller size. You can use it for deep wounds. I mean, you have to pack this. It kind of sandwiches in. But remember, you don't want, remember we talked about, you don't want to overpack it, meaning it should be a little bit smaller in the wound size, and you take your time. As you can imagine, I've been doing this for several years. I can kind of cut once, but it's better to take your time and do it right, even if it takes you an extra 5 minutes, because this can, if you overpack the wound, it can make the wound larger because it's absorbing fluid and it can kind of expand it. This is less forgiving in terms of that when you use an alginate dressing or an Aquacel, which we'll go over in another video. Even though Aquacel is a great dressing, I feel like this is better for absorption as well as removing the grime and decreasing the bacterial load or the bacteria that's in the wound, the drainage, as well as the biofilm. As I said, the only use I wouldn't use it in is a grossly infected wound where I'd probably do a wet to dry with Dakins, but it still can be used. It works fantastic with collagenase or Santal. It can be changed every other day or every day. In the insert, it can say change once every 7 days. I don't really recommend that. Unfortunately, it is expensive dressing, but most of the time when a patient is being seen via insurance, it's covered by it, but a lot of the agencies don't like to cover it. I bring my own for my patients. If you have any questions about Hydrofera Blue or any other dressings, please leave them below. I look forward to your comments. I'm Alan Bienstock. I'm a board-certified plastic and reconstructive surgeon. My expertise is wound care in the homebound and bedbound. Make sure you share this episode as well as the channel with all your friends and colleagues. Please subscribe when you get a chance, and I look forward to our next session. Thank you so much. Bye-bye.